Like all hospitals around the world, we had a very challenging year treating COVID-19 patients. At the height of the first wave, we had 3 active medical departments and 1 intensive care department treating COVID patients, with many staff members engaged in the treatment. Some of them, including myself, contracted COVID-19 whilst treating. We had many challenges during this year in many fields. Some of them were logistic challenges in building new departments. Some of them were ethical challenges about choosing who should get which treatment. For me, the most significant challenge was the uncertainties in the medical treatment. And as doctors, we had to navigate and negotiate what we think is appropriate treatment compared to what we think is inappropriate treatment. That was very challenging for me. This unusual situation, unusual year, gave an opportunity for different types of collaboration which aren't usually heard of. For example, we collaborated with Israeli special forces in developing a special mask. We also entered a lot of studies with biotech companies in diagnostics and treatment for patients with COVID-19. We entered a new realm which is unfamiliar for us, of treating patients by far, and telemedicine, which we were unacclaimed for. But even though we tried to develop all these things, we always had to have a person inside. We always had to have the staff member being with the patient, talking to him directly, making eye contact even though they could not see our smiles or frowns, touching the patient. There was no way around that, and there was no way to properly treat patients the way we want to without being there and holding their hands and talking to them. One of the challenges we see now is being able to vaccinate the whole population. We have a small but still very significant group, especially young people, who are avoiding getting a vaccination because of different fake news that they're getting about these vaccinations. And it is important to explain to them and to reach out to them and to have them get vaccinated, so we can avoid the morbidity and mortality that is involved even in a younger group population, and we can eventually manage to eradicate this terrible pandemic that is engulfing us over the past year. One of the things that personally gave me encouragement in continuing this difficult work was meeting the patients we treated, patients in critical situations, patients on ventilation, patients on dialysis, and meeting them outside of the hospital and seeing how they recovered. I still stay in touch with a few of these patients, and this is what really gives us as medical teams the force and the encouragement to continue this sometimes very frustrating job in treating COVID-19 patients.